I want to talk now about our schools. Throughout the state of Ohio, parents, students, school administrators, teachers, superintendents, all are thinking about going back to school. And the schools are making decisions, and parents are making decisions about how to go back to school. And I know that there is a great deal of frustration among Ohio citizens today because of the uncertainty, the lack of certainty. This weekend I spent some time talking to scientists around the country about the pandemic. One scientist told me this weekend, and I quote, "This virus does not operate on our schedule." Everyone, I think, feels frustrated by the uncertainty of what is ahead. I certainly share that frustration. None of us has a crystal ball. None of us can tell what's going to happen when we go back to school. We all are trying to bring certainty to something that, quite candidly, we cannot be certain about, and that is what's going on with the virus. We've never been here before. No Ohioan has faced this for 100 years. We've not done this before. We cannot know what the next 3 weeks will bring, let alone the next 3 months or 6 months or 9 months of school. Each school district in this state faces a different reality because each school district is in a different place. Different place because of their buildings, different place because of what's going on in the community, different place because of the community spread that they have and how great that spread is. The reality is, and what scientists continue to tell me, medical experts continue to tell me, when we ask about schools and we talk about schools and we try to get some certainty or some ability to predict what's going on, what I'm told is that the community spread in that community will be reflected in that school. I guess it just makes common sense. So there's really two variables. One is what the community spread is, and the other is what, of course, goes on within the school. As we go forward, the community spread may change. We've seen this with numbers that we have shared with you, and we continue to try to keep you up to date about what's going on in your community. And when the community spread changes, the school reality will change with it. We've tried to come up with the best information that we can to help provide parents who are making decisions, superintendents who are making decisions, and others about what's going on in your community. We've done a color code map. The color code map that Eric is going to put up here in a moment, this is the one we used last week. We'll change this again on Thursday. We do not have the new data computed. But this gives people an idea of what, a general idea at least, of what is going on in their community and what the trends are. We also have, do we have the other slide too, Eric? I've asked our team to come up with another way of looking at this. And this will make this available. This is a ranking of counties, and this will change all the time, but it tries to give some idea of what is going on in the last 2 weeks. So it's not historical data, it's not going back. It is what one way of looking at how community spread is in that particular community in the last 2 weeks. And so you get some kind of interesting things. I'll see how good my eyes are. But what we have tried to do here, what we have done here, I've asked our people who do the statistics of the Department of Health, and thank them for doing this. But what we're doing here is ranking all 88 counties based upon, in order, based upon the number of cases that they've had in the last 2 weeks. But we want to compare apples to apples. And so what we have done is translated those numbers into 100,000 population. So what you will see is, some surprises, I think, about, and again, this is only for the last 2 weeks. Next 2 weeks may change, but it sort of tells you where things are going. And Eric, I'm going to walk over here so I can take a look at this a little better. But you'll see, we start off at least for the last 2 weeks with the county that has the highest number per 100,000, and that would be, I think, a shock to most people. That would be Mercer County, small county, Western Ohio. The next highest is Lucas, then Wyandotte, then Franklin, Hancock, Champaign, Fairfield, Ottawa, Wood, Montgomery, and on down. Again, it is simply one way of looking at this, but what it tells us is what the spread is, in the community at a particular point in time, and that is the last 2 weeks. It does not replace the color code. Color code has a lot of indicators, and the color code is more future-looking than this. But when people are making decisions, and I'm not telling them how to make decisions or what decisions to make, but there's a lot of data out there. And I think what we know is we all can impact the school situation. Our teachers, our administrators have worked very hard to prepare for the school year and to make it as safe as they can within the school itself. But it's incumbent upon us to make sort of the sea that we all are swimming in as safe as we can. And what is going on in the community, as far as community spread, will be directly impacted, will directly impact what is going on in that school, because those kids are obviously coming out of that universe. And if you see widespread community spread, you will, in all likelihood, see widespread spread within that school. Look, we all have different goals for our kids and our grandkids, and teachers have the goals, administrators, and mostly, but more than anybody else, parents. We all do. If we're going to, whatever those goals are, whatever goals you have for your children, if we're going to achieve those, we have got to deal with the community spread. Community spread is, in fact, everywhere, as you can see by this chart, or the chart we had up a moment ago, and these are the top ranked ones that Eric now has put up here. But take a look at all of them. You can see kind of where your county comes in. But the community spread will determine how well we do. How well, if we start back in school, can we stay in school? If you start virtual, will you be able to move to in person? All that is going to depend on community spread. We told the schools early on, you got to be flexible, and so they all have come back with different plans. And again, this virus, has a mind of its own, and so we have to be flexible. But we can impact what that future will bring.